Hello, I'm Dr. Michael Dansinger, and this is my poem, A Diabetes Reversal Equation to Heal Our Ailing Nation. American leaders, I'm calling on you to inspire the nation. We're long overdue. We need strong leaders in this time of trouble who can help us see that our own strength must double. The healthcare system is in severe crisis. The costs are astounding with spiraling prices for excessive tests and costly machines. We're stuck in a rut with the same old routines. The annual cost of a common disease is more than the wars that we've fought overseas. 300 billion a year for diabetes, that is the enemy that might just defeat us. 20% of all healthcare expenses on patients who have this, a shock to the senses. 1 in 3 people may contract this illness as adults or teens due to our stillness. Here is a war that we should have engaged. Millions have died, and you bet I'm enraged. Most of these patients get complications, even though we treat them with many medications. Blindness and limb loss and chronic dialysis result from our failure to heed the analysis. You need not be an economist or scholar. We can reverse this for pennies on the dollar. Diabetes type 2, which is 90%, is due to the lifestyle habits doctors lament. Until we overcome the underlying cause, we remain paralyzed in the enemy's jaws. We know what it takes to get there in theory, but previous leaders have been too leery to make it happen on a national scale, to invest the resources to ensure we prevail. We now know the weight loss it takes to reverse the majority of cases of this diabetes curse. But coaching for weight loss of 30 pounds initially seems like it's way out of bounds. But we can learn how to do this on a routine basis for men and women of all ages and races. A caloric reduction of 20% is enough to achieve this glorious ascent out of the grips of this terrible killer, transforming sorrow into a thriller. The key isn't diet type, it's all about adherence and removing the obstacles that cause interference. Weekly coaching by an authority can normalize glucose for the majority who sufficiently fear blindness or amputation or stroke or dementia or loss of sensation. But clinicians need training in the methods we've learned to reverse diabetes in those sufficiently concerned. And we need leaders who can leap into action, who know what it takes to get enough traction. Inspiring doctors to learn to achieve reversal rates that initially seem hard to believe is the way to wage war on this foe we must beat so we don't have to endure the burden of defeat. A wealth of great savings awaits in the confines of Americans' increasingly expanding waistlines. To tap it, we must be clever and inventive and carefully craft the right incentive. But sharing a portion of the recovered wealth can stimulate people to recover their health. So every sustained diabetes remission, annually documented by a qualified clinician, should reward the patient with a cash benefit while reducing the national deficit, because success on a national scale will save dollars in billions, eyes, kidneys, limbs, and lives by the millions. The first country to declare diabetes domination will be the great envy of every other nation. When brave leaders propose with conviction an American challenge to crush an affliction, it brings out the best in our glorious nation in these times when we desperately crave inspiration. Believe with me now. Believe with me now. Believe with me now that we can rise to the occasion and solve the diabetes reversal equation.